Assalamu alaikum. Today's topic is Genetics, Part 2. I'm Dr. Sabira Aalia Dkhar, demonstrator in the Department of Community Medicine, GMC, Srinagar. Before we go ahead with the presentation, let's have a look at this short video. Population genetics. Evolution can be defined as a change in gene frequency through time. The population genetics is a subfield of genetics that deals with the genetic differences within and between population. It is a part of evolutionary biology. Population genetics involves the examination and modeling of changes in the frequency of genes and allele in population over space and time. It is concerned with whether a particular allele or genotype will become more or less common over time, and why. Here is a diagrammatic representation of how population genetics work. There are three generations shown, and it is seen that if only one individual has a specific gene to begin with and the gene does not pass on to the progeny, then no one inherits it. If an individual by chance passes on the gene to several progeny, then the percentage of people in the population with this gene could increase greatly. Hardy-Weinberg Law. The Hardy-Weinberg Law or equilibrium is a principle that states that the genetic variation in a population will remain constant from one generation to the next in the absence of disturbing factors. For instance, mutation disrupts the equilibrium of allele frequencies by introducing new allele into the population. Gene frequency plus the influence which alter gene pool is equal to population genetics. Hardy-Weinberg Law. The Hardy-Weinberg Law is denoted by the formula p square plus 2pq plus q square is equal to 1. P square is equal to frequency of homozygous dominant genotype. 2pq is the frequency of heterozygous genotype. Q square is the frequency of homozygous recessive genotype, which is equal to 1. That means it remains constant. Factors which influence the gene pool, like mutation. In mutation, the ionizing radiation and chemicals cause the harmful mutations, except in sickle cell anemia. Natural selection. The Darwin survival of the fittest process where harmful genes are eliminated from the gene pool and favorable genes are preserved and passed on to the offsprings. Population movement like industrialization, a way of living, earning facilities leads to the intermixing and distribution of genes. The breeding structure is usually in equilibrium if marriages were random, but since marriages are done within subgroup based on religion and status and so on. Public health measures. More lives are saved with medical instances like insulin, retinoblastoma, and pyloric stenosis. The preventive and social measures are health promotional measures, specific protection, early detection and diagnosis with treatment and rehabilitation. Health promotional measures. Eugenics is the practice or advocacy of improving the human species by selectively mating people with specific desirable hereditary traits. It aims to reduce the human suffering by breeding out the diseases, disabilities, and so-called undesirable characteristics from the human population. Eugenics can be of two types, positive or negative. In positive eugenics, we seek to improve the genetic composition by encouraging the carriers of desirable genotype to assume the burden of parenthood. It is difficult because of two reasons. Not biologically inherited, like in intelligence, or not easy to determine which gene would pass off to the offspring. Negative eugenics, example Hitler killing the entire race to improve the German race, and sterilizing the people who are suffering from serious illnesses to reduce the frequency of hereditary diseases. The problem is the new hereditary diseases due to fresh mutation and the hidden carriers can be seen. Euthanics. It is the study of improvement of human functioning and well-being by improving the living condition. It is the affecting the improvement through altering the external factors such as education and controllable environment, including the prevention and removal of contagious diseases and parasite, educating regarding the employment, home economics, sanitation, and housing. It is seen that mere improvement of the genotype is useless if the improved gene is not given an access to a suitable environment. Example, providing environmental stimulation for mentally retarded, that is mild children, to improve their IQ. This environmental manipulation is called euthanics. Genetic counseling. The most immediate and practical service that genetics can render in medicine and surgery is genetic counseling. Genetic counseling may be prospective or retrospective. Prospective genetic counseling. This allows for the true prevention of disease. This approach requires identifying heterozygous individual for any particular defect by screening procedures and explaining to them the risk of their having affected children if they marry another heterozygote for the same gene. In other words, if heterozygous marriage can be prevented or reduced, the prospect of giving birth to affected children will diminish. The application in this field, for example, are sickle cell anemia and thalassemia. It is possible that this kind of prevention may find wider application to cover a number of other recessive defects. Retrospective genetic counseling. Most genetic counseling is at present retrospective. That is, the hereditary disorder has already occurred within the family. A survey carried out by the WHO showed that the genetic advice was chiefly sought in connection with congenital abnormalities, mental retardation, psychiatric illness, and inborn error of metabolism, and only a few sought premarital advice. The WHO recommends the establishment of genetic counseling centers in sufficient numbers in regions where infectious disease and nutritional disorders have been brought under control and in areas where genetic disorders have always constituted a serious public health problems. Example, sickle cell anemia and thalassemia. The methods which could be suggested under retrospective counseling are contraceptives, pregnancy termination, and sterilization, depending upon the attitudes and cultural environment of the couples involved. Other genetic measures like consanguineous marriage and late marriages. Consanguineous marriage, when blood relatives marry each other, there is an increased risk in the offsprings of trait controlled by recessive gene and those determined by polygenes. Examples are albinism, alkaptonuria, phenylketonuria, and several others. An increased risk of premature death is also noted in such offsprings. Late marriages. The pendulum is swinging in favor of early marriages. The discovery of trisomy 21 in Mongols, coupled with the knowledge that Mongolism is more frequent in children born to elderly mothers, leads to a support to the view that early marriages of females is better than late marriages from the point of view of preventing Mongolism. Its incidence in a mother at age 20 is only 1:3,000 and by the age of 40 it is 1:40. Specific protection. Increasing attention is now being paid to the protection of individual and whole communities against mutations such as X-rays and other ionizing radiations, and also chemical mutations. Patients undergo X-ray examination should be protected against unnecessary exposure of the gonads to the radiation. X-ray examination of pregnant uterus to determine the presence of twin or the lie of the fetus is no longer deprecated. Rh hemolytic diseases of the newborn, which is a genetically determined immunological disorder, is now preventable by immunization by antiglobulin. Early diagnosis and treatment. Detection of genetic carrier. It is now possible to identify a healthy carrier of a number of genetic disorders, especially the inborn errors of metabolism. The female carrier of Duchenne type of muscular dystrophy, an X-linked disorder, can now be detected by elevated levels of serum creatinine kinase in 80% of the carriers. In some conditions, carriers can be recognized with a high degree of certainty. In other conditions, no method has yet been found which will distinguish a carrier. Prenatal diagnosis. Amniocentesis in early pregnancy about 14 to 16 weeks has now been made possible for prenatal diagnosis of conditions associated with chromosomal anomalies and many inborn errors of metabolism. The indications are advanced maternal age with previous child having a chromosomal abnormality, intrauterine growth delay, biochemical disorders, congenital anomaly, and screening for neural tube defects and trisomy. Amniocentesis. The examination of a sample of amniotic fluid makes possible the prenatal diagnosis of chromosomal abnormalities and certain metabolic defects. The procedure can be used as early as 14 weeks of pregnancy when abortion of the affected fetus is still feasible. The diagnosis of chromosomal anomalies is made by culture and karyotyping of the fetal cells from the amniotic fluid and of metabolic defects by biochemical analysis of the fluid. Amniocentesis is called for in the following circumstances if the parent was prepared to consider abortion: if the mother's age is more than 35 years of age with a high risk of Down syndrome, patients who have a child with Down syndrome, patients who are known to have chromosomal translocation, parents who have had a child with metabolic defect, when the determination of sex is warranted given a family history of a sex-linked genetic disorders. Screening of newborn infants. We have today a long list of screening tests for an early diagnosis of genetic abnormalities, like the sex chromosomal abnormalities, congenital dislocation of hip, phenylketonuria, congenital hypothyroidism, sickle cell disease, cystic fibrosis, G6PD deficiency, and others. Neonates should be routinely examined for congenital abnormalities, particularly dislocation of hip, which can simply be corrected at this stage. Biochemical screening of newborn infants was first used for phenylketonuria in 1966. The heel prick blood samples are usually collected at 5 to 10 days after birth. Several drops of blood is collected on filter paper, which is sent for screening laboratory. The screening of newborns for congenital hypothyroidism is carried out in most developed countries. Sickle cell disease can be detected cheaply and reliably by hemoglobin electrophoresis using the Guthrie's blood spots. Neonatal screening for cystic fibrosis is based on the measurement of immunoreactive trypsin in Guthrie's blood spots. Recognizing the preclinical cases. Rehabilitation. Since many genetic or partially genetic conditions are causing physical and mental disabilities, much can be done for the patient and the family to help them lead a better life. Genetic population screening services. The type of services like primary prevention, in which conditions like Rh hemolytic disease and congenital rubella can be prevented by in Rh hemolytic disease like postpartum use of anti-D globulin, and in congenital rubella where immunization of girls is done. In antenatal screening for congenital malformation, ultrasound fetal anomaly scan is done along with maternal serum alpha fetoprotein estimation. In inherited diseases, a carrier screening is done. For neonatal screening in congenital malformation, examination of newborn for early treatment and diagnosis is done. I hope the concept of genetic part 2 has become more clearer to you with this presentation. Thank you.